Dr. Ben Weitz here for another episode of our Rational Wellness Podcast. It's confusing to know what you're supposed to do to be healthy. What should we be eating? How should we be exercising? Should we be avoiding red meat, cheese, and butter? Should we be putting butter in our coffee? How should we be exercising? Should we be taking calcium supplements, or are calcium supplements harmful? Should we take fish oil? Is fish oil harmful? My goal is to bring clarity to some of these issues using the top scientific research and interviewing experts in the field who can help us understand some of these issues. Please subscribe to the Rational Wellness Podcast on iTunes, Stitcher, or YouTube. So let's get started on your road to better health.
The hope was so enticing back in
Rational Wellness Podcasters, thank you for joining me again today for another episode of the Rational Wellness Podcast. Our topic for today is periodontal disease, also known as gum disease, and we're going to talk about the health of the mouth. Periodontitis is caused by microorganisms that adhere to the tooth surface, along with an overly aggressive immune response against these microorganisms. This response results in a buildup of plaque and inflammation, bleeding of the gums. Eventually, the gums recede and you get a loss of support for the tooth. Periodontitis occurs in close to 50% of the population in the U.S., and 92% have gingivitis, which is only an infection of the gum tissue that has not progressed into the bone, so it's not quite as severe as periodontitis. So that's a huge number. 10% get the severe form that requires some additional treatment. And given that this is such a prevalent problem, it's very fortunate that we have a very special guest joining us today. Dr. Al Danenberg is a periodontist and a certified functional medicine practitioner and a certified primal health coach. And Al Danenberg is the author of Crazy Good Living, Healthy Gums, Healthy Gut, Healthy Life, available on Amazon. Get it today. He practices in Bluffton, South Carolina. Dr. Danenberg, thanks for joining us today.
Well, thank you. Thanks for inviting me. It's exciting.
That's great. So let's get started with the first question.
Okay.
And, feel free to take the discussion whatever direction you want, as long as we provide some useful information for our viewers and listeners, I'll be happy. So Dr. Danenberg, you are a periodontist, right. And most folks are aware that brushing their teeth and flossing are important for their gums. But many people would be surprised to learn that what they eat and the health of their digestive tract directly affects their gums. Of course, since your mouths are the beginning of their digestive tract, it certainly makes sense that if we have imbalances and problems in our intestines, that could affect our mouth. Can you explain how the health of our digestive system affects our gums?
It's a really complex question, and I can, but let's first take a look at a broader view. Let's look at our primal ancestors and evolution, because it's an important starting point. You need to really look at the big picture before you can come down to the smaller picture. So if you look at our primal ancestors, and if you believe in evolution, maybe 2.5 million years of evolution, but certainly modern Homo sapiens have been evolving for about 160,000 years. We have skeletal remains from 20,000 to 10,000 years ago that show the jaw structure, the bone structure, and the tooth structure. And today, DNA analysis of the original dental plaque that has calcified the dental calculus can be evaluated. As a matter of fact, we can determine the types of bacteria around these teeth that are 10,000 to 20,000 years old. It's just amazing.
Wow.
So these skull remains show, for the most part, no bone destruction and no tooth decay. So it's extremely rare for our primal ancestors to have had gum disease or tooth decay. You can look at primal societies in remote areas of the world today, and they're not very many, but they have been, some of them have been studied, and they don't have chronic diseases. They don't have gum disease. They don't have tooth decay. And they also don't have a toothbrush or a mouthwash, or they're not seeing their friendly dentist in a dental cave to clean their teeth. So what's the disconnect? Because today's prevalence of disease...
You mean they have healthy mouth and gums and teeth without their Crest toothpaste and their...
Yeah. Oh yeah, we'll get into that. That's
Okay.
another story. That'll be fun too. But they don't. So what's the problem here? The problem is digestion, diet, and toxic substances that are getting into our bodies that are creating all of this chronic disease. And periodontal disease is a chronic disease, just like cardiovascular disease or multiple sclerosis or rheumatoid arthritis. And there's so many chronic diseases. And I believe from all my research that there's a starting point. I believe there's a continuum of disease. I think there's a starting point, and that starting point is the gut. And I'll explain that to you. And then once that starting point damages the gut, all hell breaks loose. And that's where a variety of things, and it's very complicated. It's just not one path. There are many complicated paths to create all this disease. And it becomes a vicious cycle because one feeds off the other. And if you only treat one and not the other, you'll still have disease. So here's where I see it happening. Certain foods create damage in the gut. For example, grains, which are a modern invention from 10,000 years ago or so until now, have created a chemical that our bodies never digest completely, gliadin. And this process, this protein, irritates the gut lining. So the gut lining is one cell layer thick. And this gliadin affects the gut lining to create a chemical response, and it causes openings in the gut lining that are too large for they're too large for normal absorption of nutrients. They allow some bad stuff that's not completely digested or toxic substances to leak into the bloodstream, which is right underneath this lining.
They're creating leaky gut, in other words.
And that would be the term leaky gut or increased intestinal permeability. So once this leaky gut starts, and there are a variety of substances that can create a leaky gut, but gliadin is one of them from this food, basically processed grains, then things will leak into the gut. There is an immune response. The immune response creates inflammation, which is perfectly normal. And if the gut lining were to heal, which it would do, I mean, the cells in the gut lining repair itself in 2 to 3 days. And if you didn't reinfect it or initiate a splinter or a traumatic injury to the gut lining, then the body's inflammation would resolve itself and everything would be fine. But our modern diets create a situation where we're constantly eating these substances that irritate the gut. So this irritant occurs day in and day out. Every time we eat, we're eating some of this irritant. So we're having this chronic breakdown in the gut lining, and we're developing not just simple inflammation or acute inflammation, we're developing chronic inflammation. And the chronic inflammation and everything that's flowing in the bloodstream starts to affect other organs and changes their ability to be healthy and function properly. As a matter of fact, the immune system can go haywire and it will start attacking its own cells like the thyroid or a variety of other cells. And it's not really understood why it changes like that. But in the mouth, when you have this kind of damage in the gut, it turns out that the bacteria actually change in the saliva. So there's been some studies that were reported, I think in 2015, where patients that had irritable bowel disease or inflammatory bowel disease would actually have a dysbiosis in the saliva bacteria. And it didn't occur without this kind of damage in the gut. So the gut is a trigger. I believe it's the initiating trigger spot where all of this disease emanation is created. Once there is dysbiosis in the mouth and the bacteria start to change, then the foods that we're eating, especially sugars that feed these bacteria, cause this dysbiosis in the bacteria in the mouth to start to become more unhealthy and pathogenic. And that's where gum disease and tooth decay start to create problems. Now you have a leaky gut creating problems in the systemic circulatory system. And now you have a infection under the gum tissue developing into periodontitis, which is infection into the bone structure. And now you have two separate nituses of infection: the leaky gut in the gut, obviously, and a leaky type of situation in the vascular system under the gum tissue. If you were only to treat the leaky gut like a lot of functional medicine doctors will do, they ignore, because they're not even familiar with the new nidus of infection in the mouth. And if you're a dentist and you're trying to treat the infection in the mouth, which is effective, and you're not aware that the leaky gut is a major factor, you're going to have constant infection in the mouth and a breakdown because the immune system is compromised. So this is where I think digestion is critical. We need to put the right foods in our body. We need to eliminate the toxic foods that are there, and then everything else is fine. I don't believe in a diet. I don't believe that there is a named diet we have to live with. I do believe that our processed foods have a variety of chemicals, especially glyphosate and a variety of other things that are damaging to the gut lining. I do believe certain foods that are processed are damaging to the gut lining, like grains, like added sugars, and processed liquid seed oils. Those three elements of food groups are damaging. So if you eliminate the grains and you eliminate the added sugars and you eliminate the processed seed oils, which are all manufactured and they're very unstable, then you can eat anything and everything else you want. And of course, in my opinion, you need to eat nutrient-dense foods. You want to have the most nutrients per calorie. You don't want to eat foods that have lots of calories and very few nutrients, because you're going to gain weight. You're not going to be a healthy person. So to be practical, I want to have a nutrient-dense type of diet, eliminating all of the junk, the three groups that I just mentioned, and providing our body with the nutrition it needs. Did that help?
Yeah, absolutely. That was great. But the American Heart Association says,
oh my goodness,
we want to prevent heart disease, that we have to start consuming more soybean oil and corn oil and substitute that for the saturated fats, or we're all going to die of heart disease.
You know, they cherry-picked some of the research to come up with that conclusion. And I read a rebuttal of their recent article in Circulation magazine or journal. And it showed that, for instance, they recommended polyunsaturated oils, and they looked at a study that only lasted 2 or 3 years because it brought down, let's say, LDLs, and that's not necessarily important, but it brought down the LDL levels. But if they were to look at other studies that went out beyond 3 to 4 or 5 years and beyond, those polyunsaturated oils created cancer. It's amazing.
Yeah, no, actually,
Fascinating.
I've been working on a response to that article as well, and they relied on these 4 studies that were like 50 years old. 2 of the studies, actually, there was no decreased risk of death, because even though there was a slight decreased risk of death from heart disease, there was an increased risk of death from cancer in those same studies.
That's what I'm referring. That's what I'm referring to.
Exactly.
If the average person, even the average medical practitioner out there, you would expect the American Heart Association, the American Diabetic Association, the American Cancer Society to create a volume of knowledgeable, peer-reviewed, accurate literature for people like me and you and everybody else to go to. It's not there. And sadly enough, from what I have found, is the peer-reviewed research is not part of their research library. I don't get that. I don't understand that. And they confuse everybody because they are theoretically an authority in health and nutrition, yet they're giving misinformation. It's unfortunate.
Yeah, no, absolutely. Can you explain a little more about this nutrient-dense diet?
Sure.
What exactly is a nutrient-dense diet? I mean, give me an example of what types of foods I should have in a meal if I want to get the most density of nutrients.
So basically, I'm defining nutrient density is the greatest number of nutrients per calorie of food. Okay? So that will include all animal products that are wild caught and pastured. We're not talking about conventionally raised beef that is actually fed grains and antibiotics and hormones. We're not talking about fish that is farmed, that have a lot of chemicals involved with the feeding mechanism. We are talking about wild caught salmon in the Northwest. We're talking about cattle that have been raised on grasses and finished on grasses. We're talking about just wild animals that are eating their foods that they were designed to eat, like chickens that are eating bugs on the ground, not processed corn and soy products. So these animals actually have a much higher level of omega-3 fatty acids compared to omega-6 fatty acids. So they are more anti-inflammatory and they're nutrient dense. Then we're talking about vegetables and fruits and nuts and seeds. And I'm also talking about organic and not conventionally raised with pesticides or any other chemicals for a variety of reasons, especially glyphosate, because the glyphosate residue on...
By the way, Doc, for those folks who don't know what glyphosate is the active ingredient in a very popular herbicide called Roundup. And, Roundup is sprayed on a lot of the crops to kill the weeds, and most genetically modified foods in this country are designed to be resistant to Roundup so they can indiscriminately spray the Roundup on the crops and not kill the plants, but kill the weeds. So we're all ingesting lots of Roundup with glyphosate in it.
And California just went on record to state that glyphosate is carcinoma forming.
Yes.
Carcinogenic. So it's a scary
Sorry
scenario.
about you folks out there in South Carolina. Thank God for California.
Yeah, true. So organic doesn't just mean that there are residues that you can wash off with filtered water, for example. There's another process that you need to consider about organic food, and that is when plants are sprayed with pesticides, their immune system doesn't have to work very hard because all these bugs are killed. So the immune system in plants are phytochemicals, just like our immune system. If we were not exposed to microbes all the time, if we just went outside, we would die because of all the microbes that we would inhale or swallow. So plants actually get stronger when they have to fight off the natural bugs and whatever is in their environment. If they're sprayed with chemicals that you can maybe wash off, but they're sprayed with chemicals, their immune system, their phytochemicals are not that strong. So it's not as powerful or nutrient dense of a food if it's not organic. So organic foods are great because they're more nutrient dense, as well as they don't have these pesticides that are on their surface that have maybe seeped into their meat.
So, Doc, I know that you're an advocate for the paleo diet and that's considered a nutrient-dense diet. So I'm just going to pick one little bone with you.
Yeah.
Everybody who advocates the paleo diet, I don't understand. How can bacon be a healthy food?
That's great. First of all, let me just say,
how is bacon anti-inflammatory?
I don't like the term paleo, but paleo to me means these are the foods that a population eats because it's available to them. So the people that live near the North and South Poles in our ancestral heritage ate a totally different diet than the people that lived in the equator area. But these are paleo type foods. These are foods endemic to the population. And it's not complicated with chemicals and processing. So that's what paleo means to me.
Okay.
Yeah. Okay. Let's get to bacon because that's where you want to be. So, let me just tell you, hogs are
the bacon, Doc.
I love hog. I love pig. I love pork. So I like that. But the way I eat pork, I have a farmer locally who raises their pigs and hogs in a natural environment. They're not fed corn and soy and a bunch of other stuff, and they're slaughtered properly, and you can process this meat in a much healthier way than the hogs that are fed, unfortunately, some products that are GMO, corn, whatever it is. The other thing is, okay, you can take pork belly, which is basically what bacon is made out of. You can take pork belly and you can cut it up and cook it the way you want and season it the way you want. It's pretty healthy. But you're right. Bacon that is processed and cured, it is not a very healthy food. But then again, pigs that are raised with conventional feed and chickens that are in a cage and cattle that are grain fed, they're not healthy either. I don't want to eat any of that meat.
Right.
But I will eat the meats of free range, pastured, organic type animal products.
So I read your book and I highly recommend Crazy Good Living. It's an excellent read. You say that fluoride is a toxic substance.
Okay.
And I'm very passionate about this fluoride thing. I had Dr. Paul Conant on my podcast a few episodes ago, and I really think we're doing a horrible thing by fluoridating our water and putting fluoride in the toothpaste. But this opinion is not shared by most dentists. Dentists tend to pretty much all promote fluoride. They say that it reduces tooth decay. They often give fluoride treatments to their patients. Why do you think so many dentists have gotten it wrong when they're supposed to be the experts on the teeth?
Well, let's go back here. Fluoride is toxic. It's a neurotoxin. It damages DNA. It destroys mitochondria. I can't say anything good about fluoride, except topical fluoride in the mouth is a barrier that inhibits dental decay because it hardens a root surface. Should you put fluoride in the mouth? In my opinion, let's educate the people why there is decay to start with, and then you won't have decay. So fluoride is like, Rust-Oleum. You have a piece of metal that is rusting and you don't like the rust, so you paint over it and it looks really good. Okay, did you really take care of the problem? No, I don't think so. So there's something still under that Rust-Oleum paint. And it chips away, so it will start to decay. If you have water and oxygen, you're going to have rust on iron. So what is happening in the mouth is this. Systemic or fluoridated water has little to no benefit in controlling decay, and it has a lot of health benefits. So I don't believe in fluoridated water.
Not to mention the fact that we're giving essentially a prescription drug to people without their consent.
Not only that, some people that drink 2 glasses of water a day get significantly less fluoride than a person that drinks 2 gallons of water a day.
Absolutely. And then if you add in fluoride toothpaste and fluoride mouthwash and you're taking antibiotics that have fluoride or...
Exactly. So I'm not a proponent of fluoride. What I am a proponent of is educating people to understand why you have decay to start with. You do not have to have chemicals and barriers painted on the teeth to prevent decay. There was a great paper that was published in the Journal of Dental Research, of all places. It's a traditional dental journal in 2015 that summarized all the research up to that point about fluoride and what is really causing decay. The World Health Organization did a monograph on sugar and all the chronic diseases, including tooth decay, that sugar involved. Added sugars are the cause of tooth decay. End of story. Now, it's not the sugar that's in the banana that you ate that's causing the decay. It's added sugars, concentrated sugars these sugars that are added to food products or used to sweeten foods that normally wouldn't be sweet, these elements of sugar feed the dysbiotic bacteria in the mouth. Now, dental plaque is healthy. Dental plaque is healthy until it's not healthy. So dental plaque has a purpose. This biofilm around the tooth has a purpose. It actually maintains a pH value of more neutral. It actually kills more pathogenic bacteria. It creates a vehicle for remineralization of the tooth surface 24/7. But when that bacteria in the plaque becomes dysbiotic because of certain foods that we're eating or changes in the chronic inflammation that is available systemically, not feeding the bacteria in the plaque properly with prebiotics from the foods, then all of a sudden, the sugars that you're eating feed these dysbiotic, unhealthy bacteria and create the dental decay, as well as gum disease. So it's the sugar that's the critical thing. If you eliminated added sugars and concentrated sugars from the diet, you will eliminate or greatly reduce the incidence and prevalence of tooth decay.
That's a really fascinating point, Doc. I've never heard anybody say that the dental plaque actually has a beneficial purpose in the body.
Yes, and here's the problem. So if you're using products that dissolve the dental plaque, you are actually interfering with the normal biological function of the body. Let me give you an example. Let me tell you something that's fascinating. There was a study that was done by Johann Wolber in Germany. He's a periodontist as well as a researcher. He published this study in 2016. It's a great study. He took 15 people. He took 10 of those people and created a experimental group. 5 were the control group. The group of 15 people all had active gum disease, and they were on a standard American diet. Lots of carbs, lots of sugar, just a lot of junk. Now, here's what he did. All 15 people could brush their teeth the way they normally brushed, but they could not clean in between the teeth with any interdental brushes or any dental floss. The group that was considered the experimental group had to eat a basically paleo/Mediterranean healthy diet. In other words, they had to reduce all the carbs to a healthy level of just vegetables and fruits. They had to remove all grains. They had to remove seed oils that were processed. They ate a healthier diet. That experimental group, for 4 weeks, they examined the gum tissues, the inflammation in the gum tissues, the depth of the gum pockets, and the type of bacteria that were developing around the teeth. At the end of 4 weeks, in the experimental group, they had lots of bacteria, plaque, because they couldn't clean between the teeth. They could brush, but not clean between the teeth. However, their gum disease significantly decreased, and their bleeding points significantly decreased, and inflammation significantly decreased with all this plaque. Now, the control group that had everything going the same way, except they were eating their crazy standard American diet, had significantly more plaque, but it was more virulent. They had more gum infection, more bleeding, more inflammation, deeper pockets. So it's not the bacteria, it's the dysbiosis of the bacteria. The bacterial film makes sense because there's biological benefit to it until it becomes pathogenic. And it won't become pathogenic unless you feed the bad bacteria and it gets out of whack, just like the gut. The gut have, I don't know, maybe some studies show that maybe there's 25 to 35,000 different unique species of bacteria, not in every person, but they can find all these things out today. Some of these bacteria are extremely pathogenic, but in their homeostatic state, they balance everything off. So we just because you have a pathogenic bacteria in the mouth, you don't want to kill this because you're going to change the homeostasis. You don't want to use a mouthwash that's antimicrobial on a daily basis because you think it's going to kill the bacteria that's bad. Yeah, but you'll also kill the good bacteria, and things will then change for the worse, not for the better.
That was really, really interesting. That's a great explanation of why you can't just brush and floss and
Right.
not pay attention to your diet and lifestyle and think that you're going to have healthy gums and teeth. How can we educate the dentists? You know, I mean, that's a huge problem. They're out there and everybody respects dentists as being knowledgeable about the mouth and the gums and the teeth. And they're just, unfortunately, they don't understand the truth about fluoride, and they're spreading the wrong message. How can we educate them?
Well, the sad thing is, I don't think dentists or medical doctors want to spread misinformation. The problem is they don't know what the real information is, and they don't have a source to get the real information. I think today is significantly better than it was 10 years ago. You know, patients come to my office and they're looking for more biological or holistic concepts. 10 years ago, you know, if you even use the word, you would lose your dental license, right? So people, the population is demanding the profession get on board. The research is there, but as you know, published, peer-reviewed, accurate research doesn't get from the researchers to the clinical environment for another 10 or 20 years. So it's a slow process. I do believe that things are changing, but it's going to be very slow.
Wow.
And then a lot of my contemporaries are set in their ways. They went to dental school. They need 12 or 15 hours of CE credits a year, so they find it online or something like that. And they don't really get educated because they're not seeking it out. It's not like it's being advertised. I actually created a CE program called Beat the Beast of Dental Disease. That is a 7-hour accredited program that teaches evolutionary medicine and how it's involving the gut and the dental oral microbiome. The information is slowly getting out there, but it's going to take some time. I'm trying to do what I can do. You're trying to do what you can do.
No, absolutely.
You know, we can only touch one person at a time.
I got to tell you, I really think the time is right for a great documentary, you know, and bring in Dr. Paul Conant on this about, you know, why we are poisoning ourselves and our kids with this fluoride stuff.
Well, actually, there is a summit that's going to be aired, I think, September 18th through the 25th on the internet. It's called Functional Oral Health Summit. Dr. Scott Saunders is hosting this summit.
Oh, yeah.
And I am one of the 35 expert expert dentists that are being interviewed for this summit. And I think it's going to bring a lot of this kind of information together in one place.
You should try to get Dr. Conant on there. He's amazing on this stuff.
Yeah,
he's dedicated his whole life.
I'm not involved with actually the structure of it.
Okay.
I've been asked to be interviewed, so I was doing that.
So when it comes to toothpaste, you know, obviously you're against fluoride toothpaste. And in your book, you recommend brushing your teeth with coconut oil and baking powder.
Baking soda.
Baking soda, yes. Right. Yeah. What about some of the natural toothpastes that are available? Well,
here's the problem with natural toothpaste. Unfortunately, the word natural is not controlled by the USDA, the U.S. Department of Agriculture, which actually owns the term organic. You cannot put the word organic on a product unless it's a minimum of 95% organic. Now, toothpastes and toothpaste companies can say it is made with organic ingredients, and it could be only one of 50 ingredients that's organic. But they cannot say on the front that it is an organic toothpaste, and they cannot use the USDA label for organic. So unfortunately, the natural toothpaste that I have found have a lot of junk in it. They have chemicals, they have emulsifiers that have shown to damage the gut microbiome. They have chemicals that are too abrasive, like silica, that actually can irritate the root surfaces of the teeth. They have xylitol. Xylitol is not so bad, but when we're talking about dental plaque that may be beneficial, xylitol inhibits the production of dental plaque that attaches to the root surface. That's the assumption, that you don't want to have any dental plaque around the tooth. Well, that's not true unless it becomes pathogenic. The only thing, you don't even need to use toothpaste. You can brush your teeth with water. You can floss or use these little interdental cleaning devices. A company called Gum, G-U-M, makes these small little brushes that work between the teeth that are great. And that's all you have to do, because the plaque that is unhealthy is easily removed. The pellicle stays, but the buildup plaque that can become pathogenic because of the food you're eating can be removed easily. So you don't have to use toothpaste. But if you want to use something, baking soda and coconut oil are great. For example, coconut oil is antibacterial, antiviral, antifungal. Potentially could be a problem, but the little bit that you're using on the toothpaste and you're spitting it out is not going to be a problem. It's just going to help. It's not going to remove all this bacteria. And the baking soda actually increases or neutralizes the pH in the mouth to some extent. It has the benefit of a very slight abrasive. It's the least abrasive chemical in any manufactured toothpaste on the market. And baking soda actually can whiten the tooth structure a little bit. So coconut oil, baking soda is perfect. Now, if you were to use coconut oil to rinse your mouth, like oil pulling, and the concept would be 10 to 20 minutes of this oil every day, you will damage the oral microbiome. You're going to damage this healthy microbiome in the mouth.
Wow.
For example, let me tell you another interesting example. On the top side of the back of your tongue, you put your finger in your mouth and touch your tongue, and you went all the way back to almost where you would gag.
Yes.
That area of the top side of the tongue harbors many anaerobic bacteria. If you can clean it with a spoon and scrape it and remove some excess bacteria, that's good. And the food particles that are breaking down, especially sulfur compound foods, create a bad odor. That's good. That's where most of the odor in the mouth comes from, bad odor. Now, that anaerobic bacteria, though, plays a critical biological function. When you eat certain foods that have natural nitrate, like leafy greens, celery, and a variety of other foods that have high concentrations of nitrate, when you eat this food and you chew it up and swallow it, in your stomach and the duodenum, it starts to get absorbed into the bloodstream, and 50% actually get absorbed into the saliva. The saliva now has this nitrate that has been broken down from the food that you've just eaten. When obviously your saliva pours out in your mouth, that saliva, when it comes into contact with the anaerobic bacteria on your tongue, breaks down into nitrites. Then you swallow the nitrites, and it goes into the system in a variety of places it can affect, and it becomes frequently nitric oxide. Nitric oxide actually decreases gingival infection. And there are some studies that have been reported as recently as 2016 that show this critical pathway of nitrate to nitrite to nitric oxide that's modulated by the tongue. More than 25% of the nitric oxide in the body is affected by this pathway. If you use chlorhexidine, which is a prescription mouthwash that is highly antimicrobial, you will kill off this bacteria on the tongue, decrease your nitric oxide significantly, that it may increase your blood pressure just because you're using the mouthwash.
Wow.
There was a medical research paper that was just published in 2017 that said, hey, medical doctors, if you have patients that are having problem with blood pressure and they're using an antimicrobial mouthwash, you're increasing the risk of a higher blood pressure. So antimicrobial mouthwashes are not healthy, especially on a daily basis. Now, if you had an infection and you had to bring it under control, you might want to use and be prescribed an antimicrobial mouthwash for a week to 10 days until things get better, and then you adjust your diet and you adjust your oral hygiene program to compensate for all of that. you can't have a healthy diet and expect active periodontitis to go away. It won't work. You have to treat this disease. Once it became a significant destructive disease, you have to treat that disease just like if you had a splinter in your finger. If you had a splinter in your finger and you took all the healthy foods that you could put in your body and you exercised and you slept 8 or 9 hours a day and you had no stress in your life, you would still have infection at the tip of your finger when the splinter was. But lo and behold, if you remove the splinter and maybe wash your finger a little bit, it goes away because you remove the irritant. If you have gum disease, which is basically like a splinter under the gum at this point, you can do all the healthy things that every nutritional person will tell you to do, but you will not remove this infection under the gum until that splinter is removed. So a deep type of cleaning with a hygienist that knows what she or he is doing and a dentist that understands some of the biology of the system can take care of this problem, bring you back to a state of health, and then resolve the infection in your mouth and maybe resolve the dysbiosis in your gut and start eating a nutrient-dense, anti-inflammatory diet. Call it whatever you want, but basically put the real foods that your body needs into your body and remove the toxic elements that your body should not have. You'll be a healthy person.
That's great. I'd like to just touch on one more topic before we wrap this up. This is another clinical pearl I saw in your book is you mentioned the benefits of pomegranates for gum health. Can you talk about that for a few minutes?
Pomegranates, it's interesting. There is some research that dates back, 2,000-3,000 years about pomegranates as being a pharmacy in a bottle. There are so many biologically active ingredients in pomegranates, and it does help as an anti-inflammatory. It helps with very nutrient dense. But here's the problem with pomegranates.
Can I go to PubMed and put 1000 BC in for my search?
You can put pomegranates, and you will find in PubMed there is so much research about pomegranates. As a matter of fact, there was an article written by the Indian Society of Periodontology that actually reviewed literature about pomegranates and their health benefits as well as their gum and oral health benefits. Very, very interesting article. So pomegranates are great, but here's the problem. Just like oranges, it's great to eat an orange, but it's not healthy to drink the orange juice. It's concentrated sugar, concentrated acids. You've removed all of the fiber. I love pomegranates. It's a little hassle to open them up, and if you get them on white clothing, you're going to have stains for the rest of that material's life. But pomegranates are healthy when you eat the pomegranate seeds and everything involved with the pomegranate, just like the orange. Pomegranate juice is extremely high in concentrated sugar. So maybe the nutrients are good, but you're eating too much sugar. You're getting much too much sugar in your system. So pomegranates are great. Another great medicinal value element is raw honey. There is some phenomenal research that is published in PubMed about raw honey healing ulcers and lesions on the skin, and even using it for some infections in the mouth. And if you've ever heard the term dry socket, when you had a tooth extracted and you had severe pain in that socket, you could put raw honey and it actually heals better than medicinal prescription drugs. So raw honey is another factor. There is a lot of sugar in raw honey, but there's over 135 biological chemicals in raw honey that provide a huge benefit. But if you take raw honey and heat it, all the biology of the honey goes away, and it's just sugar water.
That's great, Dr. Danenberg. Thank you so much for joining us today. For listeners and viewers who'd like to get a hold of you, what's the best way for them to contact you?
Sure. My website is convenient. So it's drdanenberg.com. It would be spelled DRDANENBERG.com. And I write blogs almost every week. You could subscribe by email, and you'll get a little email alert when I put a new blog in, and there's a contact form. And if you send me a question, I certainly will answer your concerns.
That's great. And of course, pick up Dr. Danenberg's book, Crazy Good Living, from Amazon. And thank you for joining us. And I look forward to talking to you in the future, Doc.
Thanks for the opportunity.